Hi Ellie, my name is Taylor. I'm going to be your nurse today. So it looks like the doctor is going to send you home on some rapid acting insulin called Lispro. More common name is Humalog. Basically, your body seems to be insulin resistant. So this medication will take your glucose and push it into your cells so that your body can use that glucose as energy, therefore lowering your blood sugar, okay? Like I said, it is rapid acting, so once it's injected, the glucose will go into like your muscle cells, your fat cells, but then the medication will also work to help decrease any extra glucose produced by the liver so that there's not extra glucose hanging out in your bloodstream, okay? Any questions so far, Ellie? No? Okay, great. So it is given by injection, subcutaneous injection, which means you can do the back of the arm, you can choose the side of your thigh, or you can choose kind of like the abdomen, really the fatty tissue. And when you give the injection, you always want to rotate injection sites. This will help prevent like any skin issues, skin breakdown, skin irritation, okay? It's usually given right before meals or within 15 minutes of eating. You never want to skip a meal and take your insulin because this can lead you into hypoglycemia, which we will get into in a little bit, okay? Any questions before I go forward here? No? Okay, great. So while you're taking this medication, your primary care provider will be monitoring your A1C levels about every 3 months because this is going to check to see how your blood sugar levels are doing kind of overall. But then they will also be monitoring your potassium because this is a rapid acting insulin, and insulin likes to push potassium into the cells, which can lower your potassium level overall, which we don't like, okay? So now, one of the main side effects of the rapid acting insulin, Lispro, Humalog, is hypoglycemia. So with that being said, some signs and symptoms to watch out for can be like diaphoresis, which is sweating. It can be like maybe hunger, fast heart rate, confusion, dizziness. If you feel any of those things happening, you want to follow the 15-15 rule, which is you want to have 15 grams of like a rapid acting sugar. So that could be a hard candy like Lifesavers, maybe like a lollipop, or it could be like a juice. So that could be, apple juice, orange juice, maybe like a soda, something to get your blood sugar to come up, okay? And then you want 15 minutes after you do the 15 grams of the rapid sugar, you want to check your blood sugar again, okay? Other side effects of this medication could be like weight gain, redness, or even infection at your injection site. So you always want to make sure that you're cleaning properly, monitoring your injection sites. Any questions so far? No? Okay. So with the hypoglycemia, if there's ever a time where you maybe are severely confused, you almost pass out, don't be afraid to call 911. And it can go the other way too. If there's ever a time where you're taking the insulin but your blood sugar just doesn't seem to be going down, you're almost on the opposite spectrum, you're hyperglycemic and the insulin isn't doing anything to your blood sugar, don't be afraid to call 911. Don't be afraid to communicate with your provider, okay? Do you have any questions for me? No? Okay. And these are references.